In this morning's Health Watch, multitasking moms might experience something called mommy thumb. It's an extreme pain in the hand or wrist caused by constantly picking up your baby and even texting too much. And here to talk about it is Dr. John Knight from the Hand and Wrist Institute. Good morning. Thanks so much for joining us. Now, I have to tell you that my children are now 10 and almost 9. I had never heard of mommy thumb, but I really believe I experienced it. I was in a lot of pain, obviously carrying my children a lot, especially when I had two, juggling the two. Tell us, first of all, what is mommy thumb and how is it different than carpal tunnel?
Sure. Well, Amy, carpal tunnel is a pinched nerve in the wrist. Usually affects mothers or soon-to-be mothers in their last trimester. De Quervain's tendonitis, which has been called since the last century, early last century, has been recoined mommy thumb or blackberry thumb, and it's a group of tendons that go along the outside of the wrist that pull the thumb out. And from repetitive use of the thumb, for mothers that lift the babies up all day long, up to the age of 2, as the babies are getting heavier, lifting the baby up under the armpit, pulling the thumb out. Then also mothers more and more now breastfeeding and the way they hold their wrists when they breastfeed. All that puts extra pressure on the tendons, causing inflammation in this little tight space that the tendons run through. And then the perfect storm, working mothers typing, using their Blackberries all day, adds to it. That's the perfect storm.
And it is very painful. I can say I would sleep with a wristband because I was in so much pain in the evening after carrying the two babies basically throughout the day. Now, what can you do to treat this? I mean, besides a wristband, which did help me, but I was still in a lot of pain, what other measures can people take?
Sure. Well, the big thing is with any overuse, rest. Well, mothers can't rest.
Exactly.
So that's unlike any other repetitive motion disorder we see, mothers can't rest. So that's a frustration for me and for the mother. You can't take away the baby. So resting as much as you can during the off times when the baby's sleeping, wearing the brace when you sleep, ice, the ibuprofen anti-inflammatories of the world. This picture actually shows the tendon with the arrow to it that shows that tendon coming through the compartment. And so all those along with a wrist brace. The cortisone shot is highly effective. And about 50% of cases can wipe it out within a few days.
Oh, wow.
Yeah.
Okay. But for the extreme cases, there is a procedure that you can do?
There is. Through a 1 centimeter outpatient surgery procedure, just under local anesthetic with little sedation. We go in, 10-minute procedure. We open up that tunnel. Just 1 or 2 stitches, dissolves in a brace for a few days. About a 6-week recovery. But again, mothers can't rest, so it takes everything takes longer in a mother because they can't rest.
Now, are there things that we can do to prevent getting this? I mean, I did a lot of, I think, what they call that football hold with mine, where I had my, hands spread out with the thumb way back, like you said. I was doing it wrong, apparently. I shouldn't have been carrying them like that.
Sure. Well, obviously you can't rest too much, but the key is when you pick up the baby is scooping the baby. But it's awkward because most mothers are not going to jeopardize dropping their baby.
Exactly.
But that's the only way. Holding the thumb in and scooping up under the baby's buttock and under the torso and holding the head.
Wow. And this really is, though, different than people that have carpal tunnel, although I guess you could have a combination of the two.
You can have a combination, but carpal tunnel syndrome is a similar process, but involves the nerve that goes through the palm of the wrist, and that causes numbness and tingling. This is excruciating pain on the thumb side of the wrist. Carpal tunnel is more numbness, tingling, shooting into the fingers, more nerve symptoms.
Okay. All right. Thanks so much, Dr. Knight. And for more information on Dr. Knight and treating mommy thumb, head to our website, KCAL9.com, and click Seen on TV.